بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is an example of interactive case-based learning with ChatGPT. I asked the ChatGPT, this is a fetal MRI T2 sequence with a mass around the sacrum with minimal extension inside. ChatGPT said, given your observation of a mass around the sacrum and coccyx in the fetal MRI T2 sequence, it would be appropriate to explore potential diagnosis, investigation, and investigate further. Below is an example how ChatGPT can assist in analyzing such case, guiding the discussion and considering the differential diagnosis. The instructor present fetal MRI T2 sequence to the students, pointing out a mass around the sacrum and coccyx. As I said, the instructor said, today we will analyze a fetal MRI T2 sequence. It appears that a mass around the sacrum and coccyx. Let us use ChatGPT to help guide our discussion and determine potential diagnosis. Please observe the image and share your observation. Step-by-step interactive learning by ChatGPT. Step 1, initial observation. Instructor said, ChatGPT, can you describe the key finding related to the mass around the sacrum and coccyx in this fetal MRI T2 sequence? ChatGPT answered, the provided fetal MRI T2 sequence shows a sagittal view of fetus. Notable findings include a well-defined mass located around the sacrum and coccyx. The mass appears to be heterogeneous in signal intensity with hyperintense and hypointense area, suggest a complex composition. The mass extends anteriorly and posteriorly relative to the sacrum and coccyx. Based on the location and the appearance of the mass, could potentially be a sacrococcygeal teratoma. Instructor, good observation. What are some other differential diagnoses we should consider for a mass in this location? A student, we should consider conditions such as sacrococcygeal teratoma, myelomeningocele, lipomeningocele. ChatGPT said correct. Given the location and the appearance of the mass, let us consider the following differential diagnosis. Sacrococcygeal teratoma is a common tumor and often heterogeneous and can be large. Myelomeningocele is a type of a neural tube defect where the spinal cord and meninges protrude through a defect in the vertebral column. Lipomeningocele is a form of spinal dystrophism with lipomatous mass associated with spinal cord tethering. Anterior sacral meningocele is a rare condition where the meninges protrude through the sacral defect. Step 2 in the learning of the interactive learning with ChatGPT. Step 2, detailed discussion on sacrococcygeal teratoma. Instructor, let us focus on sacrococcygeal teratoma. ChatGPT, can you provide up more details on sacrococcygeal teratoma and imaging characteristics and types? ChatGPT, sacrococcygeal teratoma is the most common congenital tumor in neonate. It is arises from the coccyx and can extend anteriorly and posteriorly or both. The imaging characteristics on fetal MRI include heterogeneous mass contain cystic solid sometimes and calcified component leading to mixed signal intensity on T2 weighted images. Large size can be quite large and may cause mass effect on the adjacent structure. Vascularity may show prominent vascularity, sometimes leading to high output cardiac failure in the fetus. Polyhydramnios, often associated with sacrococcygeal teratoma due to fetal swallowing impairments. What are the types? Sacrococcygeal teratoma can be categorized based on where they are and what they are like. Type 1, tumor is outside mainly the body and attached to the tailbone. Type 2, the tumor is partially outside the body and partially inside the body, within the baby pelvis and the abdomen. Type 3, the tumor mostly inside the baby body but can be seen from outside. Type 4, the tumor is completely inside the baby's body and cannot be seen from outside. Here, this is type 1 as we have in our case. Instructor, excellent. What are the potential complication and management option for sacrococcygeal teratoma? ChatGPT potential complication include hydrops fetalis due to high output cardiac failure, a premature labor due to polyhydramnios and mass effect, infection potential postnatally if the mass is ulcerated or ruptured. Management options include prenatal monitoring, regular ultrasound and MRI to monitor the tumor size and fetal well-being. Early delivery may be considered if the mass causing significant complication. Postnatal surgery, surgical resection of the tumor shortly after the birth is the typically required. Step 3 with ChatGPT, question and answer and feedback. Instructor, great discussion. Are there any questions for ChatGPT about this case or related topics? Student 2, how we can differentiate sacrococcygeal teratoma from myelomeningocele on fetal MRI. ChatGPT differentiation of sacrococcygeal teratoma from myelomeningocele on fetal MRI, location, and composition. Sacrococcygeal teratoma is typically heterogeneous mass with cystic and solid component, whereas the myelomeningocele involves a protruding of the spinal cord and meninges. Signal characteristics of sacrococcygeal teratoma shows mixed signal intensity while myelomeningocele shows a fluid-filled sac with spinal elements. Associated findings, myelomeningocele is often associated with spinal abnormalities like carry to malformation, whereas sacrococcygeal teratoma does not. In conclusion, by using ChatGPT in this interactive case based on learning session, a student engaged in a dynamic discussion receive immediate feedback and deepened their understanding of fetal MRI interpretation and differential diagnosis. This approach fosters an active learning environment and prepares students for real-world clinical scenario. Thank you for listening and hoping to see you in another talk.